Rice Clinic is trying to stay away from the practice here. When a patient comes to Rice Clinic, that person is greeted with respect. Is treated as a human being. We discuss whatever is going on with that person, have in a conversation, give them options.
RISE Global Health Initiative was more than an idea. It was a call to save lives, a call to heal, and a call to give hope. RISE Clinic Nigeria, being an arm of RISE Global Health Initiative, was founded in 2012 in Adazi-Ani, Anambra State.
I believe that here in Nigeria right now, people get sick, because they're well to do. They fly to India, they fly to England, they fly to US and get their treatment. But we have our poor people here in Anambra and elsewhere in Nigeria, they don't have the finances to go overseas. So we look for a way to bring that technology back home.
We came out to Nigeria and had what we call a community stakeholders meeting, where we called the local chiefs, the local people from the town, and said, what exactly do you want? And that was where they started sharing some of the issues they have with clinical diagnostics.
The doctor put a weaver, it's America, Alicia, and everyone to work on it.
Its mission to enhance and sustain health and overall human development potential through excellence in interdisciplinary care and patient education has not fallen short. RISE Clinic Nigeria since inception has lived not only for health and wellness services, but for social and human development. It found the gap in the Nigerian community health care and filled it with love, hope, and life. In the past 10 years, RISE Clinic Nigeria has engaged in outreaches that brought smiles to the faces of local community members in Nigeria.
Empowering the communities and giving them the necessary skills will also help in whatever RISE Global Health Initiative is doing here in these communities. Now, it became paramount that when there is an accident or scene, that interval between at which the patient is moved from the accident scene to either the primary health care center or to the secondary health center like RISE Clinic here in Adazi-Ani becomes very, very important. So that's why the initiative came from RISE Global Health Initiative, that we need to train, we need to empower the community, we need to train them, we need to give them the skills, they need to acquire the skills to be sure that they can serve as a substantive first responders. Whether it's a home accident, whether it's a road traffic accident, whether it's someone that just fell ill, but there is need for them to actually fill in the gap between the time that accident occurred and when the patient gets adequate health care at the hospital.
So it looks like we're on number 3, right? It's like 3, 5, 4, 5, 6, 7, 8, 9, 10. Round 2.
3, 4, 5, 6, 7, 8, 9.
And you can imagine the lot of people that Rise Clinic was able to train, and they were now they've acquired the skill to give a basic life support right there at the accident scene. They can be able to do mouth-to-mouth breathing. They can be able to, even if it's an epilepsy patient, can be able to know what to do to keep that patient, the air, the breathing, and the circulation fit while the patient subsequently transferred to Rise Clinic.
In 2012, Rise Clinic Nigeria launched its pioneer program, Health Fair, where 1,000 Nigerians received free screening and patient education.
Something is heavy for the man, bring it closer to your chest and left. Don't lift from out like that, because when you lift, even though your legs are bent and you're lifting from out like that, you're still using your back muscles.
100 Nigerian families qualified for low-income earners health assistance. 265 local and international volunteers were trained. By July 2013, the Nigerian Epilepsy Care Advancement Program was launched, where 240 epileptic patients were enrolled for a 12-month free specialty care.
We came to the Rise Clinic to help build an epilepsy program and to help begin a movement throughout the nation to raise awareness for epilepsy.
Over 75% were seizure-free by the 7th month.
In Nigeria, if somebody's having an epileptic seizure, people walk away. And that afterwards, when the person has already moved on and is feeling better, they may even come back and burn the ground because they're concerned that epilepsy is contagious. So it was such a joyful opportunity for us to speak on behalf of the Rise Clinic and educate patients about the fact that epilepsy is not contagious, that it comes from the brain, that it responds to medications. And there were patients with tears rolling down their face telling us how grateful they were just to have that information and to be looking forward to medications. More than 50% of the patients treated here at the Rise Clinic will be seizure-free in 1 year as a result of the efforts of this organization.
These patients, these people deserve qualified individuals who have been trained specifically for a certain role within the healthcare system, providing that kind of care. So RISE, like I said, relies on an interdisciplinary system of excellence. The most important thing for us, our mission, is to show people that multidisciplinary or interdisciplinary systems work. When we put away our issues, our egos, and focus on providing optimum care for these patients. So that is the mission. If we can get these people to start talking together, if we can get them to start having a dialogue.
In October 2013, Rise Clinic Nigeria organized a free clinic day for Nigerians, which took place in different cities.
We're hitting on 3 towns here, in Anambra, Owerri, Aka, and Onitsha. Yeah, so those are the 3.
In this outreach, 2,000 Nigerians were diagnosed and provided with patient education. 800 high-risk individuals were identified and referred to Rise Clinic Nigeria. 85 local and international volunteers were trained. In September 2015, Rise Clinic Nigeria launched the Anambra Business Coalition Project, which became the pioneer public-private partnership for healthcare in Anambra State. This partnership achieved collective action in the public-private business sector, merging and management of general hospitals and private-owned medical firms, which led to Anambra Health Alliances and the renovation and reopening of the Orumba General Hospital. In 2018, Rise Clinic Nigeria embarked on a major awareness campaign on stroke management. This event was held across different centers and cities. This event also resulted to the creation of 42 international and community stroke leadership councils, 447 educated individuals, 344 screened individuals, 11 active treatment groups, and also identified 132 people at risk for stroke. To commemorate Nigeria's independence at 60, Rise Clinic, in partnership with Anambra Business Coalition, organized a medical outreach for the people at the newly refurbished Orumba General Hospital in October 2020. Here, the people were provided with free medical screening and treatments for common ailments with essential drugs and health education. Today, Rise Clinic Nigeria operates with a growing team of health professionals, has impacted over 5,000 community members, and continues to work with local and international health and academic institutions to provide educational and training opportunities. For 10 years, Rise Clinic has lived the dream well structured and will continue to live this dream. Rise Clinic Nigeria. Together, we rise.